This short lecture broadly outlines the possible higher education in anesthesia in India and abroad, as well as a career and the job opportunities available outside. This is a very short lecture, and if you want any further reference, I request to contact me. Well, as you know, anesthesia education in India through collegiate hospitals and recognized medical teaching authorities goes on in 3 different streams: MD of 3 years duration, DNB of 3 years duration, DA, which is getting phased out, of 2 years duration. And we do have, through the collegiate institution, subspecialty courses in cardiac, neuroanesthesia, pediatric anesthesia, critical care, leading to DM in the particular area, as well as fellowships of 2 years duration. The courses available now in India are, as I said, in neurology, cardiology, thoracic anesthesia, vascular anesthesia, bariatric surgery, orthopedics, complicated obstetrics, ultrasound guided anesthesia, onco anesthesia and pain management asset, transplant anesthesia. So various courses are now available, but don't worry, even though you think there are various courses, it's much less than what, say, a subspecialty like cardiology or neurology has now. That means we can branch into further courses later as per the demand. And the reason for all these things, because we want to establish global good practice in conductive anesthesia. How are you going to achieve the global good practice in anesthesia? Global good practices in anesthesia possible only through good knowledge on the subjects as well as skill. Skill, I mean technical skills as well as non-technical skills, as well as research aptitude. Once you have all these things, you may be able to establish good practice conduct, but you should be acceptable to your friends, to your institution, as well as the public. Then only we may be able to achieve that highly motivated aim called global good practice and conduct. In India, today we have around 70,000 qualified anesthesiologists. This is a rough estimation. It may vary by some thousands, but almost around 20,000 people of India, qualified through India, are working outside India. But do we have enough number of people in India? Well, as per the WHO requirement, in fact, who is estimating the manpower, their classify for developing as well as undeveloped different manpower requirement. A country like ours, which is a developing country, we may need around 3 lakhs anesthesiologists as per the population, which we are not going to achieve probably in another 5 decades. And as we go now, probably in a decade's time, we may be able to achieve half this particular requirement. That means with something like 1.5 lakhs of anesthesiologists totally, that means another 75,000 added to the strength, we may be able to have something like a 50% requirement of WHO's highly motivated requirement. Anyway, what I'm trying to say is that job opportunity in India is really sound. There is absolutely no problem of employment. Scope of employment is good in India, but people may be looking for something else. Now, what are we for? Anesthesiologists are for looking after the volume, ventilation, and pain. In fact, our main job or our expertise stands in volume, ventilation, pain management. And these are our essentially required areas. And we should have mastery in the basics as well as advisory in using ultrasonography as well as in the TE. In fact, these 2 things also should go along with our basic degree of MD, DNB, or DA, or similar sort of qualifications. But why do we need a subspecialty knowledge is that because as we go along in our career, we need some sort of specialization in our own area, in a small area, because that's going to help you only. You are not at all going to be a pediatric anesthesiologist alone or a vascular anesthesiologist. But if you have that, that's going to help you in the long run because you're going to be appreciated better. That's the reason why we say it's a specialty education. Also, in fact, that's a way all over the world people are moving ahead. When everywhere, one after getting the basic post-graduation goes for a subspecialty specialization also. Now, coming to the job opportunities abroad. Anybody can get a job anywhere in the world. In fact, that's the one thing which we have to understand. Anybody, if the country wants, if the host country wants, you could be recruited anywhere in the world. But there are some requirements which have to be satisfied. Because you should first be a graduate from an approved school. What is an approved school? Because there is a directory of medical schools kept by the World Health Organization. It's called the World Directory of Medical Schools, which is otherwise a medical school or a medical college or an institution which is recognized by the parent country's regulating authority. For India, it is a Medical Council of India. It was. Now it is a medical commission. In fact, once you have a degree from one of these particular certified schools, you are eligible for employment anywhere. That means we are also taking a lot of people from outside India who qualified. But the thing is, basically, they are people who pass through one of the institutions certified by the World Health School. And next, what you need is a pass in the licensing examination of the country. Here also, you know it, because our youngsters who are coming from Ukraine, Russia, China, or anywhere, they also have to pass a licensing examination. This is for us also. If you're going abroad, you have to pass a licensing examination of the country. That means these are the two things essentially required. That means a degree from a medically school and then a pass in the licensing examination of the country. If you have these two, you are eligible to look for a job in the country, provided you have a language proficiency. And the language proficiency differs. In English-speaking countries, UK, Ireland, Canada, Australia, New Zealand, USA, all these places, well, they need documented proficiency certificate. That means you are good in using the language. And again, in the Western Europe, Germany, France, Italy, these places, they are one step higher. They need more than the English test. They need mastery in their own language, the French or the German or the Italian language. They need some sort of an educational certification in that particular language. That means you are good to use the language which their natives are using. And one thing more, if it is going to be a Norwegian country, say Norway or Finland or any of those particular areas, well, it's slightly more complicated. You need a higher qualification in their native language. And when people say it's very easy to pass the medical licensing examination of the Norway, but it's so difficult to pass the language test of Finland or Norway. That means you had to pass that. That means there is no difficulty to get a job, but to pass this particular language test is difficult. Whereas we have some hope of getting a job easily. In the Middle East, they are not at all concerned because even though the language, most of the places is Arab, they are not at all concerned that you should have proficiency in Arabic. They believe that people may acquire adequate Arabic knowledge while on career. And in the Eastern Europe also, Eastern Europe, well, I mean China, Hong Kong, Singapore, all these particular area also, they are not that much strict on the language. That means, so you need now 3 areas: language, licensing examination, and the graduation from medical school approved. If you have these 3 things, well, you may be able to apply. And you apply, depending on the availability or the vacancy available, they may be able to employ you. And at most of the countries, centralized appointment. But in countries like Australia, it is regionalized because every province has their own ways of looking at this, and they have their own employment board which they look at. And apart from these, you have the non-governmental agencies also who are doing it. Anyway, so job is possible once you have all these things. That means anybody is aspiring for that. Look, if you want a job in a developed countries, probably you have to go for that particular English language test and the licensing examination and the graduation. But in other countries, well, you don't need certain sort of a language test. Well, they are a little more relaxed in all these things. But how far we with our Indian specialization? Unfortunately, I have to say, even though I am practicing anesthesiology for the last many years, Indian degrees are not accepted as an international specialization degree because you need further training in the particular host country where you're going to be if you want to be a specialist. That means here, if I go with many years of experience, but I'm not going to be considered as a specialist in the beginning, but I may be given some credits as well as I may be given some work exposure benefits. I may be able to get a job, but not that easily as a specialist. If you want a specialist job or if you want an academic job in a host country, you have to go along with their examination system and the qualification of that particular country is okay. But there are relaxations because depending on your experience and previous exposure, you may be given some sort of a relaxation. And again, another thing more, relaxation for spouse qualification and spouse licensing examination also is made available. That means spouse is looked after in a different way. That means there is a difference in the way of recruitment for the spouse as well as for the native and for people from outside. Now, training, residency, and employment. Standard program of any country is selection of the required persons who wants to go into their postgraduate program, say who wants to join the residency. This is basically known as matchmaking of the individual who applies for a particular course. Fortunately, anesthesia is regarded as one of the very competitive specialty in Canada, America, Australia, New Zealand, UK. These all areas recognized as a competitive specialty. But since they don't have that many people coming out to anesthesia, they require people from outside. Anyway, the matchmaking is basically for the natives who apply, because all a spouse who applies a native's care of, he may be able to get more relaxation in the particular thing. And the duration of the course is more than our 3 years course. Duration of the course, and most of the places 5 to 6 years. And the curriculum is almost the same. Only thing that a bit more epidemiology or statistics are added to. And supervision, absolutely strict in any particular country where you go, because the supervision, you are being very closely supervised in the first 3 years. And the supervision, based on the supervision, and if you have previous experience in the particular area, you may be getting credits as well as you may be getting exemption. As I said earlier, relaxation for spouse, but not for this particular credits or anything, but for all this particular process of getting into the system, there is relaxation for the spouse. Now, we will take 2 countries, United Kingdom, we are all looking for. If you want to get into the United Kingdom, it's a GMC, that means General Medical Council, as well as Royal College approved course. You have to get into or you have to get selected through a GMC recognized post as Royal College post, because all the training posts, that means the college training posts, are under subsections called a deanery. It's an academic subsection. That means group of hospitals join together as a deanery under a professor or somebody who is known around in this. That particular posts are open, and these posts are open and it's being published in all the standard newspapers of the country, as well as in their website, as well as in most of the journals coming out from UK. The training posts are advertised and you can apply for that. But selection is slightly difficult. As I said, there is a competitive specialty. If there are vacancies, probably you will be given consideration, provided you have the PLAB certification as well as language pass certification, you will be selected. But there are many alternate pathways in every country. One of the most moving alternate pathway in UK is the medical training initiatives called the MTI. This is supported by a group called BAPIO, that is a British Association of Physicians of Indian origin. And this one started 5 years back. It's basically an education exchange program, but not the exchange asks you thing. What they say in the selection is that you are being selected based on your primary qualification and your exposure in your native country. That means anybody may be able to apply if you have the postgraduate qualification and then minimum 3 years exposure in the specialty in that native country. And the plus thing about here is that you don't have to pass the PLAB here, you don't have to pass the licensing. You don't have to pass the PLAB here, you don't have to pass the language test here. That means these two major obstacles are being taken out and you are given a job. And wherever you go in on employment, it's not a training role, but it's being treated as equivalent to a training role because it's a General Medical Council approved post as well as a post approved by the Royal College. You may be able to get trained as a UK trainee through the GMC pattern or through the deanery gets trained. You are also getting trained. You can participate in the program because it's a common program. You may be able to participate in. And only handicap with that is that while getting educated, because you're not going to get exposure in neuro, cardiac, or pediatrics if you're going to join a medical initiative program, because it is being done at a different hospital under a separate deanery. So you may not get much exposure in neuro, cardiac, or pediatrics. Anyway, the highest advantage is that no PLAB, no language, but there are handicaps. Even though you are paid equivalent to what otherwise a trainee in the GMC route or the GMC pathway or the RCOA pathway gets, you also going to get the same salary. But unfortunately, now the MTI or the medical training initiative is open only for 2 years duration. That means you may be able to get 1 more year if you apply in the last 6 months. That means maximum you may be able to get 3 years. Within that particular 3 years, if you can pass the degree, well and good. And you have to return to your native place or elsewhere. You have to leave UK after 3 years because you will not be allowed to come back. And you can never get an employment in the UK on this particular specialty after getting trained through the MTA. But there is one plus thing. If you are not able to clear the fellowship examination in 3 years, you are given exemption and you may be able to sit for 2 more times. Well, you may be able to sit for the examination, but you had to return after passing the examination. And for completing the examination process, you cannot hang on to the country because after 3 years, you have to leave the country. That means unless you have some sort of a spouse or some sort of legal residency permit, you are not allowed to stay here. And apart from this MDA programs and the training slot through the GMC oblique RCOA, there are various other short programs, but it's not good for any particular employment in the UK because you may be able to get a course in anesthetic epidemiology, you may be able to get a course in regional anesthesia. These are all paid courses, but it's not good for employment in the UK and they will not give you any employment. And at United States, it is slightly more complicated. Here also it goes along the matchmaker program because if a native who passed the MBBS or equivalent, as well as a non-native who passed the UCMLE and the English language test may be able to appear for the matchmaker program. That means licensure examination, UCMLE is passed, and you have the number of years of experience, and you have the language proficiency, you may be able to get matchmaker program. Unfortunately, only natives are preferred. Again, as I said, competitive specialty. That's the reason because it's anesthesia is the 5th highly paid area in US. And because of that, a lot of natives go for the course. And there may be some 5 to 10% seats vacant every year that's distributed globally. And here they are a bit more concerned. They like to have their own nationals given job. And there are many, many alternate pathways in United States to get employed there and get qualified there because American body is so kind that you may be able to join through different pathways. Different pathways are, you can take up a fellowship in a public health area, or you can do a research in a public health area. or in clinical area, you may be able to do a research under a known figure. And if you do research for 2 years, you get credits. And with the recommending letters from your particular boss or the particular persons who were looking after your particular education or the research or the fellowship, you may come into the matchmaker program and sometimes you may get selected. And all the fellowship programs or the research programs are paid when it is being run by a university or a collegiate institution. But there are other voluntary programs also. Voluntary programs where you have to pay for your fees as well as you have to pay for your living. You don't have any support from the particular area where the course is offered or the particular job opportunity or doing the research or the voluntary program is offered to you. You had to find money from your side. But again, they're kind because they give you facility for a fixed number of hours to do part-time jobs. That number of hours is just limited to make enough money for your living, nothing more than that. That means, again, another pathway open. If you want, you can join something called a physician assistant program. That means you are a sub-physician or an assistant to a physician, and you get into that particular course, pass the course, within 3 years' time, you are eligible to come into the matchmaker program, and you may sometimes get permission to carry on your residency program. So once you complete the residency program of 5 years, sometimes with the discounts or say relaxation, it may be reduced to 3.5 years. Once you get that particular program completed, you are going to be board certified. Once you are board certified anywhere in North America, including Canada, you may be able to get an employment, but you are not board qualified. Unless you pass the examination, you are not board qualified, or you may not be able to look for an academic job in the USA. So these are the areas. Apart from there are many other pathways, because these pathways, they open up every 3rd year or every 5th year, depending on their requirement. And those people who qualify and use that particular pathways, they may be able to get engagement. Again, native spouse relaxation is there too much. If you have an American husband or an American spouse and you are registered already through the legal courts, well, you are given an exemption in all these particular things you may be able to get. So what my advice is, look into that particular angle if you are really looking for a job or a residency or settlement in the USA in anesthesiology. And these are all what I would like to speak now on this particular matter. And if you have any particular doubt, I may be able to help you in my reach. And I could be contacted on my mobile number or on email number. And wish you all a good conference day. Thank you.